Because croup is a respiratory illness, the most important assessment will be a respiratory assessment. When performing a respiratory assessment for croup, the nurse will hear a harsh, metallic barking cough, also known as the seal cough. The nurse may also hear some inspiratory stridor and hoarseness upon auscultation. The nurse may see the child using accessory muscles when breathing, some nasal flaring, and retractions. Cyanosis, restlessness, fatigue, or listlessness, and an increased respiratory rate are signs of hypoxia and should be reported to the physician immediately. Other paramount assessments are hydration status, anxiety, and the parent's ability to care for the child. As most cases of croup are cared for at home, the parents or caregivers will need to be able to cope with the illness or any emergencies that may arise and intervene as appropriate. The nurse will also assess for pain, a fever, increased heart rate, paleness, sore throat, and a history of croup and respiratory infections. Special considerations for a child with croup include decreasing their fear and anxiety. A few ways to help decrease fear and anxiety would be maintaining a calm environment and letting the child sit on their parent's lap while being examined. The nurse can also use playful but appropriate ways to explain treatments to the child, such as using puppets or stuffed animals to explain how a nebulizer works. Enforcing rules like an army sergeant when your child is scared and sick is probably not going to help, so the youth clinic website suggests that, if possible, you should give in to the child's demands more than usual. I interpret this as saying yes to a fourth popsicle, but no to finger painting the dog. Being more agreeable should aid in maintaining a calm environment and keeping the child comfortable. You want to push fluids to keep the child hydrated, and the youth clinic suggests using a teaspoon of honey to soothe coughing fits. During the clinic visit, other serious respiratory illnesses such as pneumonia and RSV will need to be ruled out. The child can go back to school after the fever is gone and feels well enough to join in normal activities. Unfortunately, in the youth clinic setting, the patient education piece is sometimes lost due to the small amount of time awarded to each patient. I believe the visits are scheduled in 10 to 20-minute blocks depending on what the child is coming in for. However, when educating a parent about croup, these are some of the education topics on the youth clinic's website: keeping the child hydrated, croup reoccurrence, and when to get additional help.